Hello, everyone. My name is Gil Penalosa, and this is Cities for Everyone, the webinar where every other Tuesday I invite fascinating people to share their stories and their experience so that all of us can become better advocates on creating cities that are equitable, sustainable, and playful so that everybody can live healthier and happier. Originally, I'm from Bogota, Colombia, and I've been living in Toronto, Canada for the last 27 years. 20 years ago, I created the nonprofit 880 Cities. I have been fortunate to have worked in over 350 cities all over the world, and this webinar is a way of giving back. And I thank Cities for Better Health and 880 Cities for helping me cover the out-of-pocket expenses. Today we have a wonderful session. The title is The Neighborhood Revolution, Shaping Healthy Cities, because the neighborhood is at the core of everything that we do. So Hélène Chartier, who's the Director of Urban Planning of C40s, based in Paris, is going to do the introduction, and she has brought three guests. One is Adriana Sansayo from Brazil, Joy Mombaya from Kenya, and Agustina Besada from Argentina. Hélène, thank you very much. Please tell us about yourself and tell us about how the neighborhood revolution can shape healthier cities. So welcome all of you, and Hélène, please tell us about yourself and tell us about how are we gonna make healthy cities through the neighborhood revolution.
Thank you so much, Hélène. Thank you for having me again. And I'm very honored to come before Anna because I met with her 2 years ago, the former mayor of Stockholm, and she's an amazing woman. You're totally right. And also to be there with Adriana, Joy, Agustina. I know they're fantastic projects, so that's I'm very excited about this session. And I just want to say where I am. And actually, Adriana is just sitting next to me. I'm at the World Urban Forum right now in Baku, in Azerbaijan. So the UN Habitat big assembly with NGO, urban planner, architects, city leaders from all over the world trying to discuss especially how we can improve amenities, neighborhood housing for everyone. So it's very inspiring. And just to say that the discussion we are having right now, which is about planning from the bottom up, planning at the neighborhood scale, is and also how we combine the different benefits and especially create health for everyone is a very important discussion right now. So it's a perfect timing. And Gilles, as always, you have the right topic at the right moment. So, and I'm going to share my screen.
We've been talking about in Portland, they said the 20-minute city, in Paris, the 15-minute city, in Sweden, the 2-minute city. At the end of the day, it's about neighborhood. People understand it's neighborhood. The neighborhood is how are we going to have all the basic needs within walking distance, but also about equity. That's why it's also, you mentioned, it's about healthy cities, because it's not about just a few wealthy neighbors having everything within walking distance and lots of low income not. So this is about equity and sustainability. So tell us about it.
Yeah, exactly. So let me share my screen. Hopefully it works. Yeah, okay. So yes, I will tell you about this form of neighborhood revolution that many of us here are trying to push, and at least what we are doing with C40 and also with the City for Better Health program that is also a great supporter of what we do. So really to foster healthy community, we must make neighborhood not only healthy or climate friendly, but really livable and desirable for everyone. And we know that the 20th century urban model is no longer fit for today. We know that with the introduction of car, we have created cities that have, lack a little bit their magic. Let's be honest. We introduce a new mobility system, but instead of winning time, we have actually lost time because we extend the distance in the city with sprawl, with also very monofunctional neighborhood because people can just jump in their car and cross the cities. And we create this form of land use fragmentation and public space that are very car-oriented. And we know that this design from the previous century is actually a lot of the challenge cities are facing today GHG emission, air pollution, consumption of natural land, but also so not good for the planet, but also not really good for the people. Very long commute. We have more mobility, but we lose time. This is crazy. We have a lot of amenities, a lot of neighborhoods that lack the basic amenities. And also this form of gray infrastructure everywhere, it's also increasing extreme heat and increasing climate hazard in our city. So, but there is, as Jill said, there is a due momentum, especially since COVID, let's be honest, to really redesign the cities and especially to move away from this very monocentric city where you have this form of integrated, very intense city center surrounded by peripheries that are monofunctional and spread. And to really promote this model of polycentric cities made of multiple complete and walkable neighborhood. It's really a vision that a lot of cities are pushing. They use different terminology, exactly as Jill said. Here a few names from China, from Argentina, from all over the world, but the principles are a little bit the same. And from a strategic planning perspective, I'm an urban planner, so it's something that is also important. It makes a lot of sense. And actually here, at the World Urban Forum, there is a lot of discussion on how really this form of polycentric cities, where there is multiple urban centers that are mixed use, walkable, is shaping the new city. Seoul is really a great example with their new master plan that they have really shaped and identified 100 neighborhoods that are in the city and that they want to consolidate by increasing access to services, walkability, and really shaping their specificities. And I want to say that with UN Habitat, C40 and UN Habitat has been really working together on an urban planning accelerator to really push this vision and a climate responsive urban planning. And we have already 34 major cities who have been committing to this vision to embed climate action in the master plan and to adopt this polycentric city. So this is happening right now. But I want to say this model of a polycentric city is also a formidable, as we say in French, an amazing opportunity to also accelerate a more bottom-up approach of urban planning, of urbanism, that a lot of people are asking for. I still think that top-down planning, to plan for new housing, to coordinate infrastructure growth and infrastructure development and growth, to also implement risk-informed planning is super important. But we need to complement this by a form of bottom-up approach where community can also shape their own neighborhood and what makes sense for them. Local amenities, public space, access to nature, all of these different things. And these two approaches are coming together. And that's really what we are trying to push. And I believe it's a two-leg of the same body, and it's a two-leg of really shaping a good urbanism for our cities. So revitalizing neighborhood with the people and for the people around the principle of climate, because it's an entry point for C40, but also, as you were saying, inclusion, livability, and health. It's very important. And to start this neighborhood revolution, we have defined with also all our partners like 4 core objectives or main objectives. The idea of a complete neighborhood, so making sure that in each neighborhood, not only the privileged neighborhood, but in each neighborhood, there is a form of mix of use, an access to amenity, also a mix of people. Social mix is also very important for a livability point of view. The public space transformation is also very important, and to the form of revolution around the active mobility is also very important. The inclusion, because all of this transformation, and that's a critique that a lot of cities are hearing, and it's the important critique that sometimes this form of transformation of neighborhood could also create some gentrification. So that's why it's very important to make sure this is happening across the city and to prevent any displacements, but also making sure that this is a root initiative bottom up where the people participate. And finally, making sure that nature is coming back to city. We know that in urban environment, in cities, nature has fell from 30% in the previous 20 years. So we have lost a lot of our green space and nature in our cities. But now it's coming back, and a lot of cities are trying to develop more green in the city because they see a lot of positive for their population. So that's the objective of this form of neighborhood revolution that we are trying to push. But now it's how we get there. And I think there is also 4 implementation pathway: proximity-driven and participatory planning, place-based and data-informed design, cross-sectoral. It's not just about mobility. It's not just about social function. It's not just about greening. It's bringing together all of these different objectives to do a good design. It's also about how we can start from low-cost tactical pilot, but also to scale and to foster long-term change across the cities. As I was mentioning, scaling is very important. It's very important to have that in mind when you pioneer new policy tries this type of project in the city. The objective is to scale in the long term. And why we are doing that? Because, as I was mentioning, C40, the climate organization, it has a very concrete impact on climate. And there is a lot of evidence on this. It's promoting this form of green and thriving neighborhood, polycentric development of the city. It will reduce GHG emission and climate vulnerability. It will make the case for a livable, compact city. We need people to stay in city, but people who stay in city if they have also a healthy and livable urban environment. It's definitely reduce transport-related emission. It's also minimize urban heat island, and it increase soil permeability and prevent flood. There is the IPCC climate experts from the UN bodies have really mentioned that this vision of good urban planning, polycentric, 15-minute city model, whatever we call it, if we adopt that at scale, we could cut global emission by 25%. And we know this is key. Transport accounts for 37% of the GHG emission, and it's the fastest growing source of emission in our city. So doing that, it's a climate action. But for mayor, for city leader, for inhabitants, climate action is important, but it's sometimes seen as a disconnected goal. But it's also very important in terms of health for the inhabitants, because improving access to green aspect, to have it and encouraging active lifestyle, it has very direct it has very direct consequence on heart disease, chronic respiratory disease, diabetes, obesity, and there is plenty of evidence that shows that. We also know that better access to local services and amenities, especially bringing closer to the people, local screening, prevention campaign, health outposts in community centers, also bringing fresh food. We see a lot of cities trying to also having this form of better access to fresh food in underserved neighborhood. This is also a health issue. Increasing quality of life is quality of the air is also very important, especially for chronic respiratory disease. And obviously, cooling the public space with the increase of the temperature is also very important. Nature shading is a natural cooler for urban environment. And we know that extreme heat island is a very important factor that increase chronic disease like hypertension or asthma. So this vision of the cities, it improves climate objective. It's also really improves the health, the urban health for people. And with City for Better Health and Novo Nordisk, we have been really pushing this vision through different project. And one that I wanted to mention today is a Healthy Neighborhood Explorer that we have been developing, and that it's online. We can share the link. You can see the QR code here. And it's really used 26 different urban design actions to estimate the climate and the health benefits of design and the transformation of neighborhood and public space. It's a very interesting tool that first can show you a lot in a lot of cities. If your city is a 15-minute city, if your neighborhood is a 15-minute or not a 15-minute city, and then if you test a few transformation of the neighborhood, it will tell you the impact of this project for the health, in terms of life expectancy, in terms also of the risk or the decrease of the risk for coronary disease and heart attack. And that's a very important tool that will help designer, urban planner, city to make their decision. And also, and for us, it was very important to bring the two topics together. It also tells you how it reduces the GHG emissions, so it's also mitigate the important climate risk. I mentioned climate, I mentioned health, but I think, and Jill said very clearly, it's also very important that inclusion and livability is at the center of this type of project. Because we know public space is the living room of the neighborhood. Public space is a garden of those who doesn't have one. So it's very important that these projects first are started in underserved neighborhood and serve the most vulnerable population. It's also all of these projects help a lot child-friendly and also senior-friendly city, because in a lot of cases, both are coming nicely together. And it's also because it's participatory, really tailored to the inhabitants' need. And this form of revolution, we are already seeing that happening in a lot of different countries. I would like to mention 3 concrete examples that we have been supporting and that you may have already heard, but I will mention them, and then you will hear from the other speaker their fantastic project as well. This one in Milano, in Europe, in Italy, it's a very interesting project. They start around the school environment, and Milan has a big problem because they have a lot of parking on the street. So the street of Milan are totally congestion with cars that are parked. And so they try also to reverse that a little bit, especially it's a hot city. It's a city that is very nice to live outside. And they start with tactical urbanism by experimenting a form of transformation, especially social function in the public space. It was such a success that after 1 or 2 pilots, they decide to launch a call for their community where everyone, teacher, family, anyone, social actors can propose a specific space in the cities and propose a draft of project for this type of tactical urbanism and public space transformation. They received so many projects that the cities have analyzed, and now they have implemented more than 70s, all 70s all across the cities. So it's really something that now it's led by what the population wants and that the city support to develop and implement. And a lot of these projects are now being made permanent, and it's a very important. The second program that I wanted to mention, it's come from Bogota. I was just earlier today with the Secretariat of Habitat of Bogota, and it started with a program from the previous administration called Barrios Vitale, but that the new also mayor is pushing through a program called PIMI, which is really focusing more on the informal settlement, because as I was mentioning, starting for the underserved neighborhood is very important. And that really combine different type of action, access to amenity, public space transformation, also some in habitat improvement to transform this neighborhood. And they have really reached a very successful project. Here you can see just a few projects, but there is a lot of projects happening right now in Bogota in this spirit. I needed to add a project from my city, Paris. That has been also quite a big revolution for the city of Paris. It's called les rues aux écoles, the school street. And it says that school is the core, the heart of the neighborhood. And they really wanted to have this public space transformation happening in every neighborhood. And they thought that starting with school, starting with children, where we all know that today children in cities doesn't have the freedom to move anymore, and giving them the freedom to move, and especially near their school, that was really the idea. And also with the idea of reducing air pollution near school and also increasing cooling through greening in the school. And they have done not only 1 or 2, but they did it in more than 200 school streets. So now you go in Paris, and most of the school nearby the most of the streets nearby the school are actually pedestrianized, and it's actually a very important place where children are learning how to scoot or to bike, and generally the parents are having a cafe in the nearby terrace. So it has really intensified the social life and the quality of life in a city that were losing a lot of family and inhabitants, especially after COVID. So making the city more attractive for family and with a more healthy urban environment to raise children, it was a very important goal from the previous mayor and the new mayor of Paris also. Just wanted to finish with one slide, because just to say a little bit what C40 is doing with this agenda. We have a program, it's called Green and Thriving Neighborhood. We are working with the City for Better Health, but also IDB, Urban Partner, GALE, a lot of different partners to accelerate this agenda. A lot of actors are doing it, but we try to do our part. I would say we have supported more than 25 neighborhood pilots, a little bit in the spirit of what I mentioned before. We organize a lot of webinars with cities. We have 52 cities really engaged in this program and that really sharing their experience. We organize in-person workshop where city leaders are coming together. We are part of very important conference like the World Economic Forum and other knowledge projects. The monitoring platform that I was mentioning before, a campaign to also push this form of vision outside C40, and also a partnership and collaboration with amazing people like Jill today. Thank you very much. And I just wanted to finish my presentation to ask you, when are you starting your neighborhood revolution? Thank you so much.
Exactly, because that's what we would do these webinars for people to get inspired and excited to do things. And Hélène, you are amazing. The director of urban planning and design at C40. You have been to so many countries. But Hélène, one of the things people keep asking is, what if I'm in low income? What about I live in an emerging country? Today we have people from India, from Turkey, from Paraguay, now we're going to have 3 cases, short cases from Brazil, Kenya, and Argentina, and then we open it up for Q&A. So Adriana, welcome. Please share the screen and tell us about what is it that you are doing in Brazil.
Good afternoon, Gil. Nice to meet you all. Let me share my screen. Can you see it?
Yes.
Okay. Good evening. Thanks for Okay. My name is Adriana Sansão from the Federal University of Rio de Janeiro, and I will present a work developed by more than 100 people. The Oswaldo Cruz Urban Lab upgrades public spaces.
Thank you.
Upgrades public spaces in the Oswaldo Cruz neighborhood in Rio de Janeiro through the implementation of tactical urbanism interventions supported by an extensive participatory process. The initiative is a development of the Sustainability Corridors pilot project developed by the City of Rio de Janeiro in 2024, funded by the IDB and the C40 with the participation of the university together with the Supervision Urbanism. The Oswaldo Cruz Urban Lab is the second phase of this project, expanding the scope of the pilot by applying the replicable methodology to 3 new sites in the neighborhood. Carried out in 2025 and supported by Novo Nordisk and C40, the lab was led by ProURB, UFRJ, in partnership with the City of Rio de Janeiro through several municipal agencies. The engagement process involved stakeholders such as schools, quilombola communities, neighborhood associations, shop owners, and residents. Organized into 5 phases with strong community participation, the project builds a set of small-scale and replicable solutions developed together with the community to address local challenges related to sustainable urban development, mobility, infrastructure, and climate adaptation. It began with a co-creation phase at 3 selected sites: the surrounding of the train station, the riverbanks, and the connection route between the station and the park. The activities aimed to gather ideas from residents using co-creation tools. The design used the results of the co-creation process to develop proposals and included a workshop carried out with students. Proposed actions included street redesign to widen sidewalks, new crosswalks, artistic murals, urban furniture, community gardens, planting beds created through depaving, new vegetation, and recreational areas. The urban furniture workshop brought together students to the design, fabrication, and installation of pieces made of wood. A total of 16 pieces were produced, including benches and garden protectors. The validation phase was when the designed ideas were presented back to the community for confirmation and adjustments. During the implementation phase, students and residents worked collectively for 3 weekends, especially women and children. Local labor was hired, and priority was given to contracting services by purchasing materials from neighborhood business to stimulate the local economy. Municipal agents actively participated in actions such as street redesign, creation of new crosswalks, and the paving for the installation of planting beds and trees. Local professionals worked on community gardens, planting vegetation, and street painting. Local artists painted artistic murals. Students installed urban furniture. The evaluation phase consisted of new workshops to assess the results, distribute manuals to support the maintenance, and establish agreements and commitments for their upkeep. Activation was the final phase and included the official unveiling of the murals, samba performance, a DJ, a lecture, a workshop with the public traffic school, an exhibition of projects developed by students, distribution of popcorn, cotton candy, seeds, a plant seedling, and a capoeira performance. In quantitative terms, the participatory process involved 192 members of the local community, 65 professors and students from the Federal University of Rio de Janeiro, 30 municipal employees. Different types of impact were observed during and after implementation, as you can see in the image. According to the tool developed by C40, the intervention generated several health benefits, prevented traffic-related deaths, increased the life expectancy, and contributes to the local economy. Residents living around the square take care of the space by replanting, watering plants, and preventing informal parking, demonstrating the success of the transformation at this site. The project revealed articulation between the urban planning and local-scale urban design, synergies between university, public, and private sector with international collaboration, participatory process, and community engagements as a project-based modus operandi, and the provision of a toolkit of small-scale solutions with high replication potential, innovative, and feasibility for Latin American contexts marked by social and environment vulnerability. That's it. Thank you, and sorry for the beginning.
No, Adriana, this is great. Thank you very much. It's amazing how you presented and how the role that having the support of Cities for Better Health and C40 and others, but at the end of the day, a community, how the local people design and implement it. Now we have Joy. Joy is going to be presenting on her project in Kenya. Go ahead, Joy.
Thank you. Thank you very much, Jules. And let me also share my screen. And I will put it on play from start. Yes, let's see whether it goes from the start. There we go. We ready to move it, Gilles? You can see it all right?
Yeah, but put it in full screen in present. Yeah, perfect. Go ahead.
It's in full. It's just a bit slow. Okay, thank you. So my name is Joy Mboya. I work with an art center called the Go Down in Nairobi. And we have a project that is called the Dunga Road Renewal Project. It's an ongoing effort to understand how people-centered interventions can begin to transform the experience of the city And in this specific instance, the street as a public space. Under the Healthy Cities initiative, our project is contextualizing best practices from around the world around green transitions, around healthy environments, healthy residents, but through the lens of culture. But when we say culture, we don't mean culture just as art, but also culture as the lived realities of everyday urban life, how people inhabit the city. And Dunga Road is one of the major corridors that links the southern part of the city of Nairobi with the main central business district, and our art center is located on this road. So when we first started systematic engagement in trying to begin to change this road, as far back as the COVID-19 time, we worked with women and girls as the primary stakeholder group to assist us to assess the street. And with the women, we assessed access, we assessed users and uses, we looked at safety, we looked at comfort, we looked at environmental conditions. And through this process, the women were able to generate a baseline street plan for the Dunga Road, which has been validated. Now, with this particular initiative, the Healthy Cities initiative, we then have an opportunity to begin to test the plan through tactical urbanism, very practically. And last year, we started with a group of young artists as co-designers and implementers of this particular process. So the artists also did a street audit, just as the women did, but they were now trying to identify spaces where temporary low-cost interventions might be made. Once they finished their audits, they went into an ideation phase where with their mentors, who were senior artists, they began to try and translate these observations into practical interventions that could improve the street experience. And so I'll show you some of what they were doing, so before and after murals. So there were various interventions that they made in consultation, of course, with the street users. And these murals, as you can see, introduced color and a sense of place in the corridor. And one of the things we've noticed is how this particular mural that you're seeing right now is attracting attention. Some of the users are stopping and are taking selfies right here. And here's another example of a mural. Now over here we have an eatery on Dunga Road, which actually has become one of the most significant social spaces on the street. It's a place where people meet to eat, they wait, they rest, and they socialize. So the intervention here focused on how to improve and dignify this space that, of course, is very heavily used already. Along Dunga Road, there are very few mature trees, and one of the trees had its roots exposed. It was in danger, it was vulnerable, and this particular intervention was focusing on protecting and stabilizing this particular intervention. And we can see that besides protecting the roots of the tree, this particular artist also then placed a bench around the tree, and of course this quickly transformed into a space again for resting and gathering. And we can see how a small action then becomes something of, really big social value. In that same area, vicinity of the tree, there is a boda boda shelter. The boda boda is basically the motorcycle transport system that we have in Nairobi. And one of the artists then combined seating improvements with murals. And what was very interesting here, I think, is how the motorcycle riders were fully involved in the installation of this particular bench and also supporting the mural work. They even brought the welders who located this bench themselves. And then one more is another artist who now worked with art on the footpath. So he was exploring how the pedestrian experience can be improved. And one of the things, again, that we noticed with his intervention is in the afternoon when the sun now sort of creates a shade over this area, people sit here, people rest here, people wait here, people pause here to make phone calls. And then this 6-month process that these young artists engaged in ended in a street festival where the local workers, the mechanics, the street food sellers, but also the residents from the informal settlements in the surrounding area and some of the middle income residential areas all joined in a celebration with dance and music. Now, since then, we have engaged in additional studies, and these are observational studies that we're doing in-house with our Go Down Urban team, where we're focusing on this eatery pocket, this cluster where there is high activity. And some of the things that we've been looking at is trying to just understand the patterns of people sitting, of people lingering. How are they sort of naturally stopping and waiting and resting and socializing? And you can see some of the images over there. But some of the things we've also noticed is the desire lines that are beginning to form, particularly pedestrian desire lines. And these are the routes that people are creating for themselves to cross the road, because this road at this point in time has no formally marked crossing. And here you'll just see, if the video plays, an example of what that crossing begins to look like. The road can get very busy, particularly in the peak times, and it can get quite dangerous for crossers. So you can see the vehicles also don't really stop for them to cross. They just have to try and find their way through it. Of course, we identified that there are vulnerable users on the street. They're elderly people, they're persons with disability, they're children. And this just reinforces, the importance of safer crossing. And again, just one more video. These little girls, these 3 little girls trying to cross the street, and they have to have a bit of a long wait. One gives up and walks away. These 2 that are remaining find that the space is open, and then they hold hands and they try and get themselves across the street. So this brings us actually to the next stage that we're at, which is what is next. And so now we are embarking on the implementation of a formal crosswalk and related improvements around the area with planters that can also be used as seating. And this is work that we'll carry out with the Nairobi City County, the departments responsible for mobility, for public works, for environment, and for culture. And of course, they'll do this also in conjunction with the Roads Authority. I think one of the things we're seeing with this process is that it's showing how community engagement, culture, and small-scale interventions can begin to shape more inclusive and people-centered urban futures. But we think that there needs to be an acceleration of this shift in how our planning frameworks expand their learning from such pilots. And thank you very much. I will now stop sharing.
No, that was great. Small examples, and like Hélène was saying at the beginning, the scalability is so critical. We're going to see the last presentation, Agustina from Argentina. I love Argentina. People are so nice, and Agustina's gonna, great. Now we have the full screen because we are running a bit late, but we'll have time for a few questions.
There I go. You can see full screen now?
Yes. Yo como
good. Exactly. Well, hello, everyone. As this sign says, I eat healthy and tasty. And I am fortunate enough to know the connection between health and healthy food. And I have access to it. And I know where to find it in the local markets with local producers. And this is very important because I live in Argentina. And here it's very, very common to use agrochemicals in food, ultra-processed foods, which are not healthy. So the question here was, how can we make healthy food accessible to everyone? Because unfortunately, not everyone knows the importance of eating healthy. Not everyone knows where to find it. So the idea was to expand something that was already happening at these Sabe la Tierra markets, which is a network of local producers that grow and sell healthy food to many, many other places in the neighborhood. So I am Agustina Besada. I'm the director of circular economy at Asociación Sustentar. And we partnered with Sabe la Tierra, which is this network of local producers, and the municipality of Vicente Lopez, right in the suburbs of Buenos Aires City. And it's a very, very populated area. So we wanted to bring this healthy food and healthy goods access to everyone. How did we do it? Thanks to this Novo Nordisk and C40's challenge that we were selected to implement this project. We work on these 3 different axes. We wanted to build a healthy network of suppliers. Then we also wanted to create demand, working on workshops for different ages. And then we created a healthy route to promote this connection, this supply of healthier products, and the demand on the knowledge of wanting to eat healthier. So the first thing that we achieved was creating this network. Not only local producers, more than 30 local producers were selected, and we created a catalog with all their products. And we wanted to do this in order to make this very, very easy for shops and different retailers in the neighborhood to start incorporating these producers in their supply of products. So everyone has access to it around the corner. And it's not just on Saturdays at the farmers markets that they can access it. So the whole concept was to build these partnerships between local producers and local stores. So we built this network that between these local producers and healthy shop, and we created this seal that recognized the shops that incorporated healthy products from this network. The second thing that we did was create the demand, the awareness, the learning how to use these products in their daily life. So we participated and created this series of workshops in 19 kindergartens and schools and 2 community centers with elderly people, because we wanted to reach different age ranges. We wanted to get into the houses of the students that participated in the workshops. And they were nutrition and cooking workshops, but then also gardening workshops, because it's really important for people to understand where their food comes from and value the local production instead of ultra processed foods that are not healthy for them. We reached more than 600 participants in these activities. And then the third part, we wanted to activate the neighborhood. So we wanted this not only to be sustained because we created these partnerships between producers and retailers, but also to let everyone know what was happening. So we created this 3-day event, creating itinerant activations in different locations. At the store of a local producer, we would have a vegan parrilla barbecue. Then we would have a tasty a wine and cheese with local producer of cheese at the winery shop. So we created all these activities to engage everyone in the neighborhood and make them aware that this was happening and that they can now access these healthier alternatives at these stores. But furthermore, what we realized is that these activations had were not only good for the moment activation for that instance, but also some of these shops created stronger relationships with these producers. For example, they started ordering more and more alfajores, which is a typical pastry here, at one of these cafes that they hosted an activation. Or for example, La Pianca Cafe, that replaced bread in their daily menu with crackers from a local producer named Crop. A direct, lasting commercial connection that we built through this program. And then another example is Cat Restaurant that incorporated San Gusto plant-based burgers permanently into their grill menu. Imagine, this is a barbecue place incorporating plant-based burgers. So for us, these are just 3 examples, but we keep monitoring what are the outcomes and real impact of this project. And now we want to scale, we want to replicate, and we want to grow, because we realize that building these commercial connections and building this network, it's beneficial for everyone, for all stakeholders involved. So we want to leverage Sabe la Tierra's network. Sabe la Tierra operates more than 40 markets a month only in the city of Buenos Aires. So we are already in conversation with the local city of Buenos Aires municipality. We are already in conversation with the Novo local office. They are all interested in seeing how we can replicate this activation and route and network that we learned from this pilot project in Vicente Lopez to everyone. And we are happy to converse and talk to anyone interested in replicating this model into their cities, because we learned a lot. It was really challenging, and we learned a lot in the process. And we are happy to replicate the learnings that we had. Thank you.
Oh, thank you very much. And people remember cities are different. Neighborhoods are different. Even within the neighborhood, each street is different. So it's not about like on the computer that we copy and paste. No, but we can adapt and improve. Everyone can learn from everyone. So we are running out of time. So the last, each one of you, less than 1 minute each, a call to action. But you have people here from all over the world. What would be your call to action, your recommendation that people should do? Let's start with Adriana.
Oh, let's go to the streets and let's start doing, I don't know, festivals. Let's start with temporary activations, and then let's try to scale all these this first and very small actions in the city to bigger things.
Well, Agustina.
Well, I love to push everyone always to think systemically. So not only what can I do in my life to change as an individual, but also what can I do to change my neighbors' behavior, to make their life better. So that's how we can start thinking systemically on how to make everyone's life better.
Joy.
I say, let's just get up and do it. You know, find your agency, find your voice. Do not be afraid. Get involved in any way, whether small or large. Get involved. The city is our home.
Yeah, just do it. Show up. And finally, Hélène, tell us, what is your call to action?
Oh, just building on what have been said, I think we are in a world where the large scale, the world is very scary. And we are sometimes a little bit all in our little bubble with our family. But I think the neighborhood scale is a perfect scale for us to have really concrete action on transforming. And I think it's something where we can act, where we can make difference. And it's also very reassuring in some way to do some good. So I totally echo what Joy and Adriana and Agustina are doing. And I think they are amazing women.
Thank you very much, each one of you. I'm so grateful for the work that each one of you are doing in your neighborhoods. You are really improving the health, physical, mental, and social health of people of all ages and abilities in each one of your neighborhoods. So thank you very much. Thank you, Hélène, Adriana, Joy, Agustina. What a wonderful presentation. You showed so many concrete examples of how in neighborhoods, most of them in lower income areas of the cities, in different contexts in Brazil, in Argentina, in Kenya, but also in France, in Paris, and many other places. Thank you all of you for having had this knowledge and sharing it and showing us what is possible and having a call to action to move from talking to doing. Thank you. I hope that everybody will share this video with their decision makers, elected officials, city staff, media advocates, and others. Because this is about creating cities for everyone. Thank you.